I think there are 4 systems of the body that contribute significantly to pain. And this really leads me to our framework on how we deal with pain. So anybody with a chronic pain, chronic health condition, this is how we would treat you. Perfect biomechanics, movement of the body, that's what biomechanics is. Perfect function starts with your ribs perfectly stacked on top of your pelvis. If you want to know what that feels like right now, pause the tape, inhale through your nose, and exhale completely. And I mean all of your air. Get all of that air out. In through the nose, exhale out. And keep going. More. And what you feel the more you exhale out is you're going to feel your abs contract. You're going to feel them turn on. And what you're feeling is you're feeling the abs pull the pelvis up and pull the ribs down, stacking them perfectly on top of each other. Now, it is a little bit more complex than this, but for simplicity's sake, that's where it starts. We need the ribs perfectly stacked on top of the pelvis. All of the functions of the body operate best from that position. So that's where it starts. So when we talk about chronic pain, chronic health conditions, human movement, human performance, true fitness, it's your ability to maintain that and express dynamic movement, performance, strength, power on top of that without losing that. If you look at the best athletes in the world, that's what they're able to do. If you look at Tiger Woods, golfers, the best golfers in the world, they're able to maintain that stack throughout the golf swing, right? They're able to snap it back. If they get out of it, they can snap it back. The greatest pitchers, the best athletes in the world that I've ever worked with, the best movement scores are the pitchers who can throw really hard because they're able to twist in and out of it. They can come back to it. It's that stack. That's the thing. If you've got chronic pain, you've lost the stack. Okay, that's what we need you to get back. So the ribs on top of the pelvis, that's where it starts. Layer number 1 that we need to look at is posture, right? If you've got chronic pain, chronic health condition, if you're worried about performance, we've got to see, do you have that stack at all? Where are your ribs stacked on top? So the first thing that we're looking at is posture. Statically, while you're sitting here, while you're standing, while you're commuting, while you're doing anything, while you're performing, what is the static posture of your body? We've got to start there. The second thing we've got to look at now, the next layer, is breathing, right? So we kind of couple them together in layer number 1, posture and breathing, because they go so hand in hand. Aside from your heartbeat, breathing, respiration is the most fundamental movement that the body goes through. It's a very muscular movement. It's the intercostals of the ribs have to expand and contract. The diaphragm has to descend and ascend, as well as every other muscle and system in the body have to adapt themselves to the respiratory mechanics. So next, we have to look at how you're breathing. How functional is your breathing? Is your breathing throwing everything else off? The average human is going to breathe 22,000 times every single day. If you don't have that right, nothing else after it can be right. So it all has to start there. Our diagnostic process begins with posture and breathing. How does your stack present itself when you first walk into our office? The second thing we've got to look at is strength, all right? So if you're an athlete, right, and somebody bumps you in a basketball game, are you able to maintain that stack? Or at the very least, if you get out of it, can you snap it right back and perform out of that? All of the best athletes in the world, again, have that ability. All of the athletes who are leaving some on the table, I know that's many of the people out there. Those folks are losing the stack, right? They're not able to start there or stay there throughout the game. So now we've got to know that you've got a reasonable amount of strength to maintain that through life's many adversities. So system 1 is posture and breathing. System 2 is strength. System 3 is energy production. Think long, sustaining energy. Can you maintain that stack under duress and for a long period of time? Can you hold it from morning until night? We see people go through stages of getting better. First, they feel better right after the exercises because we've put them right back in. Next thing, they're able to maintain it for the morning, or then 2 p.m. is when it starts to fade away. We want you to be able to hold it all day, all week, all month, all year, all lifetime, right? Throughout a game, if you're going to put pressure on it, we work with NFL players, right? If you're going to get hit by an NFL linebacker, You've got to be able to do that in the first quarter and the fourth quarter in games 16, 17 in the Super Bowl. You've got to be able to make it last. So metabolic energy production is level 3, and that's just a different level of training. All right, that's the third system that contributes to significantly to pain. And then the fourth one is my favorite one, is central nervous system regulation. Number 1 is, can you maintain that stack? Can you achieve that stack? Can you maintain it through respiration? Next is, can you do it under duress, under, getting knocked around a little bit, right, through life's challenges? Number 3 is, can you do it for long enough? Can you produce long sustaining energy to be able to maintain that stack, maintain biomechanics for long enough so that you're not in pain, so you're not promoting health conditions down the line, which does happen. And then the fourth thing is, can you maintain it under cognitive demand, under the stressors of life, under the stressors at work, under the stressors of, you're taking your kids to soccer practice, under workout stressors, under, the many challenges of life. Are you able to do that? And so what we do at Saint Bartholomew is we are taking all 4 of those components and bringing them together.